let's talk about how long it takes a diabetic to potentially go blind. Diabetic-related retinopathy is the leading cause of blindness. 1 out of every 4 diabetics develop this condition, and they're on their way to go blind. But that's not the only thing that happens. The feet go numb, you get chronic systemic infections, the kidneys go bad, the heart goes bad, and you lose brain function. If you're a diabetic new to my channel, you're going to be very happy that you're watching this video, because this is going to really help you if you understand this simple concept. High levels of blood glucose cause bleeding of the tiny capillaries in your eyes right around the retina. The retina is the extension of your brain. It's the thing that you use to see. It's a nerve tissue, and it's fed with capillaries. And high sugar destroys the blood flow to the nerve. But not just the nerve, the feet, the kidneys, the heart, and the brain. And then what happens in the eye is you get all sorts of collateral blood vessels that the body is trying to drive blood flow to and oxygen. But what eventually happens is the retina dies simply because of lack of nutrients and oxygen. And this is completely unnecessary and can be easily avoided. The longer the exposure of glucose on the eye tissue will determine the complications. 10 years of chronically high blood sugars start developing complications of diabetes. And then the next 10 years, things get worse and worse and worse. So if you're testing your blood sugars with an A1C test, that would mean that it's over 8. And I have a little story I want to tell you about. I was in practice for 29 years, and I saw a lot of diabetics come in for all sorts of neuropathies and pain syndromes. And I remember working on this lady, and her husband kept coming in with her, and he had diabetes. And he was taking medication, and they're trying to keep it controlled, but it was always on the high side. And I kept talking to him, and his wife kept begging him to change his diet, and he didn't. His awareness wasn't there. So anyway, one day he came in with his wife with those little canes, with glasses. He actually went blind. So I've seen it happen myself, and it's sad, completely unnecessary. Let's say, for example, you were diagnosed last year with diabetes. You might be thinking, oh, I have 9 more years to go before I start getting complications. What you have to realize is this high blood sugar situation has been hidden for many years before you were diagnosed. Probably 20, maybe even 30 years. In other words, it takes a very long time of having insulin resistance before the cells of the pancreas, the beta cell, starts losing its function to the point where you don't have enough insulin. And now this mechanism right here is no longer working. And then if the insulin goes down, now the blood sugars go up. You may already be experiencing other complications like fatigue, especially after you eat lunch, or maybe you have to get up several times a night, or you're constantly thirsty, or you're constantly peeing, or you have skin tags, or you have poor circulation. There's many other complications. There's some things that are really, really important and things that are not very important. The most important thing is to bring your carbs way down in your diet, okay? If you're new to my channel and you don't know about the keto plan and you don't know about intermittent fasting, I put a very important link to watch and learn and apply this, because if this is not too bad yet, you could potentially reverse some of this just with your diet alone. In the meantime, there's a very important nutrient that you can get. I don't sell it. You can get it from any health food store or online. It's called benfotiamine. I'll put the spelling down in the description, but it's called benfotiamine. And you'd want to take 4 of those capsules per day. What that nutrient can help you do is immediately reduce the complications, because it helps to counter some of the free radical damage that's destroying the capillaries. But of course, that's not going to work long term unless you reduce your carbs and start doing fasting. So check out the link down below and learn more about it.
Hey, we're back.
With another amazing recipe.
No grains, no sugar, totally keto. There's no suffering in keto.
Absolutely not, Karen.
And it's an immune system builder.
Absolutely. You have to check this out.
I think you should hurry up, watch the recipe, and make it yourself. It's just so easy to be keto.
But is it simple?
It's super simple. We hope you enjoy making it as much as we are enjoying eating it.